Laryngeal cancer, or larynx cancer, is a type of throat cancer that affects the larynx, the voice box located in the throat. The larynx plays a vital role in breathing, speaking, and swallowing, and laryngeal cancer typically originates from the epithelial cells lining the larynx. It is most commonly squamous cell carcinoma, which starts in the flat cells that cover the inside of the larynx. Causes and risk factors: smoking. Smoking tobacco is the leading risk factor for laryngeal cancer. Both cigarettes and other forms of tobacco use, such as cigars or pipes, significantly increase the risk. Alcohol consumption. Heavy alcohol consumption, particularly when combined with smoking, greatly increases the risk of developing laryngeal cancer. HPV human papilloma virus. Certain strains of HPV, the sexually transmitted infection, can lead to throat and laryngeal cancer, though this is more common in other areas of the throat. Age and gender. Laryngeal cancer is more common in men and individuals over 55 years of age. Occupational exposure. Exposure to certain harmful substances like asbestos, wood dust, paint fumes, or industrial chemicals increases the risk. Family history. The family history of head and neck cancers may slightly increase the risk. Poor diet. A diet low in fruits and vegetables may be linked to a higher risk of developing laryngeal cancer. Gastroesophageal reflux disease (GERD). Chronic acid reflux or GERD can cause irritation and may increase cancer risk. Symptoms. Early symptoms of laryngeal cancer may be subtle, but as the disease progresses, symptoms may include hoarseness or change in voice. One of the most common early signs is persistent hoarseness or voice changes lasting more than 2 weeks. Sore throat. A persistent sore throat that doesn't improve with treatment may indicate laryngeal cancer. Difficulty swallowing, dysphagia. Pain or discomfort when swallowing is a concerning symptom. Lump in the neck. The lump or swelling in the neck may indicate enlarged lymph nodes or the spread of cancer. Ear pain. Referred pain from the larynx to the ear can occur. Breathing difficulties. In advanced cases, the tumor can obstruct the airways, making it difficult to breathe. Persistent cough. A chronic cough, sometimes accompanied by blood in the sputum, may also be a symptom. Diagnosis. If laryngeal cancer is suspected, the doctor will conduct the following tests. Physical examination. A thorough examination of the throat, mouth, and neck is done to check for lumps or abnormal areas. Laryngoscopy. A laryngoscope, a thin, flexible tube with a camera, is used to visualize the larynx directly. This can be done with a flexible fiber optic laryngoscope. Biopsy. If any abnormal areas are seen, a biopsy will be taken to test for cancer cells. This can be done during the laryngoscopy or through a surgical procedure called direct laryngoscopy under general anesthesia. Imaging tests. CT scans, MRI, or PET scans may be used to determine the size of the tumor and whether it has spread to other areas, such as the lymph nodes. Endoscopy. In some cases, an endoscope may be used to examine the entire upper airway and esophagus for additional abnormalities. Staging. Laryngeal cancer is staged based on the size of the tumor and whether it has spread. Stage 0. Cancer is confined to the top layer of cells in the larynx and hasn't spread. Stage I. Cancer is localized to one part of the larynx and hasn't spread. Stage II. The tumor has grown into another part of the larynx but hasn't spread outside the larynx. Stage II. The cancer has spread to nearby tissues or lymph nodes. Stage IV. Cancer has spread to nearby tissues, lymph nodes, or distant parts of the body metastasized. Treatment. Treatment for laryngeal cancer depends on the stage of the cancer, the location of the tumor, and the overall health of the patient. The main treatment options include surgery, partial laryngectomy, removal of part of the larynx while preserving the ability to speak and breathe normally, total laryngectomy, removal of the entire larynx, with the creation of a permanent opening in the neck stoma for breathing. Patients will lose their natural voice and may need a voice prosthesis. Laser surgery. In early-stage cancers, laser surgery may be used to remove tumors without affecting the surrounding tissue. Radiation therapy. High-energy rays are used to kill cancer cells. It may be the primary treatment for early-stage cancer or combined with surgery or chemotherapy for more advanced cases. Chemotherapy. Chemotherapy drugs are used to kill cancer cells or make them more sensitive to radiation. It is typically used for advanced cancer that has spread beyond the larynx or to shrink tumors before surgery. Targeted therapy. Drugs like cetuximab target specific proteins on cancer cells, often used in cases where other treatments have not been successful. Immunotherapy. In advanced stages, immunotherapy drugs like pembrolizumab may be used to help the immune system fight cancer cells. Recovery and outlook. The prognosis depends on the stage of the cancer and the patient's overall health. Early-stage laryngeal cancer has a higher survival rate, especially if diagnosed and treated before it spreads. Later stages or recurrent cancers have a poorer prognosis. Survival rates. For early-stage cancer, the 5-year survival rate can be over 80%. For advanced cancer, survival rates drop to about 30 to 50%. Coping and support. Speech rehabilitation. For patients who undergo a laryngectomy, speech therapy with a voice prosthesis or other techniques can help regain the ability to communicate. Emotional support. A cancer diagnosis can be emotionally challenging. Support from healthcare professionals, counselors, and cancer support groups is often beneficial. Lifestyle changes. Quitting smoking and limiting alcohol consumption can help prevent recurrence and improve overall health. Prevention. Quit smoking. The most effective way to reduce the risk of laryngeal cancer is to stop smoking. Limit alcohol. Reducing alcohol intake, especially when combined with smoking cessation, can significantly lower the risk. HPV vaccination. Vaccinating against HPV may reduce the risk of cancers caused by the virus, though HPV-related laryngeal cancer is less common than other head and neck cancers. Early detection and lifestyle changes can greatly improve outcomes for individuals with laryngeal cancer. Regular check-ups and prompt attention to persistent throat symptoms are essential.